So I'm Amanda DeVries. I'm an LSS Lutheran Social Services Supervisor and Clinical Therapist in Watertown. And on behalf of the 605 Strong team, I welcome you to Caring for Our Caregivers During a Worldwide Pandemic. So just real quick, 605 Strong is for individuals or for groups. And we do webinars such as these. We'll do webinars on any topic, and we also will do presentations or webinars that can be tailored to a specific group or topic or organization. So if that's a need, please let us know. There's listening and support service for those feeling stress and anxiety due to COVID. Also, the financial strain we know has been huge lately as well. It's free and anonymous and confidential. Normally in disaster response, crisis counseling looks like door-to-door, going into communities, but with the pandemic, we need to provide services virtually. And one way we're doing that is anybody, for free and anonymous and confidential, can call 211 or text 605-STRONG to the number listed here on the screen. And you will get a crisis counselor, and they will speak with you. 211 also has a lot of available resources for all counties and cities in South Dakota. So they do a really great job of connecting people with resources, or they also crisis counseling is short term. So if someone needs more long-term counseling, they'll refer to a mental health center. This is my email address as part of the 605 Strong team. You're welcome to email me with any questions, or if your organization or group would like to have a webinar presentation done specifically for you. And this is the email address for Shauna. She's not on today, but she is the 605 Strong team member from the Helpline Center. Okay, so at this time, I'm going to turn it over to our presenters today, and they're going to take over from here.
Hello, and welcome tonight. I'm Tricia Warner, and I have been with LSS for about a year. And I've had some previous experience in healthcare and hospitals and schools, mental health centers. Had about 20 years of mental health history, and also been a family caregiver.
And I'm Zee Zere. I've actually only been with Lutheran Social Services for almost a year now. I currently do functional family therapy as well as aggression replacement training. Prior to LSS, I was at Lifescape for about 5 years. So as Tricia said, welcome. So we're going to go over what is caregiver burnout, what does it look like, how can we cope through it, and as well as how can we support each other with the new skills that we learn. Caregiver burnout is really about stress levels and how we are coping with them. No matter how well we prepared for this pandemic, it's really been a test to us all. One thing that we've noticed is there has been an increase. About half of the U.S. population is suffering from either depression and anxiety related to the pandemic. We've also seen an increase in suicide, as well as suicide rates among caregivers themselves. So we need to know what do we know about stress, depression, and anxiety, and how does it look like for us? Can we recognize it when we are stressed? And do we know how to reduce stress when we are feeling it?
Okay, so in recognizing the symptoms of stress, that would be different things, physical, emotional, spiritual, could be physical signs as well, like converting your physical symptoms that are actually related to emotional issues, clenching your teeth or your jaw, headaches or muscle aches and pains, gastrointestinal issues, maybe even some weight loss and weight gain. Hair loss is another thing too that can happen. Feelings that people might have in recognizing these symptoms of stress could be irritation, anger, denial that there even is an issue. Maybe other people are noticing irritability though around you, different things. Feeling uncertain or nervous or anxious, feeling helpless or powerless. lacking in any motivation, maybe not doing work to the level that you normally would at home or at work, feeling tired, overwhelmed, or burned out in general, feeling sad or depressed, difficulty sleeping, having trouble concentrating would be another. With these being some of the most notable signs of stress, we're going to dig a little deeper and look at how stress affects our lives. And now, if you don't have something in front of you already, we ask that you grab a pen and paper, and we'll participate in a quick assessment. This will determine where you are at with your own caregiver burnout, possibly. So we'll give you a moment to get a pen and paper.
So the best way to start coping is to understand where you are at currently. The following questions will score your stress levels. This is actually part of a larger scope assessment, but for timing purposes, we have narrowed it down to important questions that we feel are most relevant. So we'd like you to take a moment to score yourself from 0 to 5, 0 being never, and 5 being always. And I'll kind of read those questions out loud for you as well as we go through them. So starting with number 1, do you feel you don't have time for yourself? Do you feel stress between work and or family? Do you feel lack of motivation to go to work and or be with family? Do you feel that your work relative affects your relationship with family members, coworkers, or even friends in a negative way? Do you feel that your health has suffered because of work and or family? And do you feel your social life has suffered because of work and or family? And do you feel that you have lost control of your life? Just kind of take a moment to go through those. Don't worry, you don't have to share your score with us. We just kind of want to give you an idea of where you're at. Assuming that everyone is done, we'll go to the next slide. So use this time to reflect on the emotions that you feel, especially around the scoring that you've received. As you notice, 0 to 8 is no to mild burden, 9 to 15, mild to moderate, 19 over high burden. This assessment will kind of allow you to recognize where you're at and what type of support you need, because for caregivers, burnout is mental, it's emotional, it's physical exhaustion, and may develop through having the responsibilities of taking care of other individuals. Many times we don't take a moment to recognize that we are stressed. And for some, it could be because of guilt, shame, or even pride, or maybe we just don't even allow ourselves to feel or think that way. But knowing where you stand is going to be one of the first steps in moving towards reducing caregiver burnout. Because the next step is finding out ways that work for you in coping through the stress, especially in this worldwide pandemic.
Next, we'll talk about coping and enhancing your resiliency, coping with stress and becoming more resilient. It's important to communicate, if you can, with your coworkers or supervisor, other employees about your job stress. Talk openly about how the pandemic is affecting your work and you personally. Maybe having to take some time off because of a family member who had to have a test done or something, a child at home doing school. Identify factors also that cause stress and work together to identify solutions. Ask about how to access mental health resources in your workplace, such as your EAP. Next, second is identify and accept. This can be easier to say than to do, but knowing what you have control over can help. Focus on those things that you can control. Increase your sense of control by keeping consistent daily routines, and when possible, one that's kind of similar to what you were doing before the pandemic, trying to get enough sleep, having good nutrition, eating healthy meals, taking the time to do that. Take breaks during your work or during your shift to rest, stretch, or to check in with supportive people. Could be colleagues, friends, or family. Enjoy those non-work activities, especially things like exercise, spending time outdoors. It's been pretty nice out lately, so we haven't had much snow yet. Relax with a good book, watch a good movie. It's good to separate yourself from your other duties and focus on those things that you enjoy, really. Humor is important as well, and also gratitude is something a lot of people are using too. Could be a daily calendar that you use, or just noticing, journaling to what you're thankful for every day. Avoiding updates on the pandemic can be good. Take breaks from watching, reading about, or listening to news stories like social media. With my clients, I do that. I kind of forget to do that myself sometimes. I'll talk to them about how much time are you spending reading about this pandemic, and I need to cut back on that myself, I know. Hearing about the pandemic repeatedly can be mentally exhausting. It's important to, number 6, to reduce alcohol intake or other drugs. Sales are up 41% compared to this time a year ago on alcohol. Online sales are up 339%. So alcohol is the fastest growing e-commerce department among consumer packaged goods. If you feel you're misusing alcohol or other drugs, including prescriptions, to ask for help from a doctor, mental health provider. Mental health conditions too, if you have some depression, anxiety, or other pre-existing issues you've already had before the pandemic, definitely if you're being treated for a mental health condition, continue with your treatment, talk with your provider, especially if you experience new or worsening symptoms. Something that's really helpful, and we work with our clients on this, maybe we don't do it all the time ourselves, is engaging in mindfulness techniques. Something really simple you can do if you don't have time to go take a long break is just some breathing exercises or meditation. We all hear people say, just breathe, when we face our stressful moments in life. The reason why breathing techniques are proven to reduce stress and anxiety is because of the many benefits that it has. It reduces stress, lowers heart rate, reduces depression, can be used to manage chronic pain, regulate body's reactions to stress and fatigue, and reduce the possibility of burnout for caregivers. We all, of course, know how to breathe, but do we know how to breathe correctly in order to reduce stress? I'll ask you to do a little breathing exercise now. You might want to be as comfortable as you can get. Sit with your feet flat on the ground, head, shoulders, and neck supported either against the back of a chair, or if you're where you can lay down with a pillow behind your head. Get as comfortable as you can. And we're going to have a breathing exercise come up, but just breathe deeply, let the air come in through your nose, filling up your lungs while your lower belly rises. Do this about 3 to 10 times. Next, we have a slide that's going to show you how to do this. And it gives you a visual, which is really nice. There's apps that you can download on your phone to do this as well. Hopefully everyone participated in that and you feel a little bit more rested and feel a little better. Next, we're going to move into providing support during a pandemic for healthcare workers. So nurses, doctors, different people maybe in the hospital systems. right there on those front lines with the COVID patients that you're seeing or the families that you're dealing with, and their stressors as well. It's important to invest in training for healthcare workers. Many employers have been struggling addressing mental health in the workplace for healthcare workers. Healthcare workers are very strong, stoic, don't often admit they have their own issues they're dealing with, possibly. Companies that have focused on importance of mental health services training prior to the pandemic have shown to have more success with their employees than those who have tried to tackle the issue later on. It's important to look for different mental health employee resource groups. It could be a coworker, it could be even an organized group within the organization, to increase awareness and to talk about things. There's different training platforms like the one that we have tonight, and especially if there's budget issues that can hinder some companies from figuring out how to invest in training. There's different webinars and different programs. I'm noticing different things online lately. So another thing for healthcare workers is using rewards and incentives wisely. A lot of people are getting extra pay for coming in more shifts and things, but what a lot of people need is more rest. So it's good to understand what staff identify as effective for rewards. Many organizations have focused on productivity-based compensation, like I was just noting. This only encourages individuals to overwork, and then that can lead to increased burnout risk. Successful approaches in reducing burnout and stress have been seen when using work-life flexibility as an incentive instead. It'd be good to promote flexible, family-friendly work environments that meet the needs of a diverse workforce. And for mental health workers, how to provide support during the pandemic. One thing would be practicing personal restoration. This can include therapy for oneself, spiritual practices, exercise, proper sleep and rest, time with loved ones. Enjoy your life in a way that's sustainable. Everyone needs some downtime, restoration, especially those in helping professions. It's good to remember who you are and meet your own needs. We're working on meeting other people's needs a lot of the time. Connect with others when we're not in that therapist role. Seek some time in nature, seek solitude. Keep in touch with yourself. It can be helpful to consult and get peer support. Instead of struggling with difficult cases on your own, it's good to seek consultation from experts, colleagues, supervisors. Ongoing peer support and consultation can be really helpful in preventing burnout. You know, our organization has weekly meetings and we have supervision, so that's really helpful. Also for mental health workers, it's important to grow as a person. We're not just a therapist there to help others. We're full people with our own needs, desires. So whether your passion is painting, writing, cooking, or other things, make time to do what you love. But don't make our clients just the only center of our lives. But take care of ourselves too.
I think for the last,
Go ahead.
I was gonna say, I think for the last one, you probably saw a duplicate in the mental health giver thing information that you had in front of you. So that's my apologies. I sent you a duplicate of the same.
Oh, yeah.
Yeah, that's all right. I can just go over this one with you. So this one is providing support during a pandemic. This one focuses on family caregivers. First thing is important is to find resources in the community. Now we had listed off quite a few different resources, especially with caregivers at Active Generations, Center for Disabilities. They have support groups as well for siblings and families, parenting classes that could be offered. But one of the best ways to get in contact with what resources are out in the community is to contact 211. Let them know what it is that you're looking for, and so that way they can kind of lead you in the right direction. Utilize respite care. This is great just due to the fact that as a caregiver, you need to know how to have that work-life balance And that means that you come first as well. Taking time to yourself. And when you're taking time to yourself, it's really about self-care, doing things that you enjoy, which we discussed earlier in those coping skills for stress. Maybe look for a support group that you can join, and maybe be able to have that free time to attend therapy, counseling, take those walks. But either way, just to be able to separate yourself from that work, and give yourself a moment to regroup and get that energy back before you go back in and continue being a caregiver, as well as support network. Of course, this is really important too. And I know with the pandemic, one thing that we're losing is those connections. Via Zoom does not have the same type of effect as we would when we're holding or hugging our loved ones or seeing them. And so how do we stay connected with our support system, our support network? And that's really starting to utilize other ways to contact them, maybe, texting, phone call, even Zoom, FaceTime, or even having them drop off a meal to the front of your door just by asking for that help. Really utilizing, who is my support group? How can I use my support group? And how can I make sure that I'm also available to be part of a support group? Because even though you might need help, it might also be somebody that could use your help as well. Just making sure you're available and that you have individuals that are available for you as well.
So moving forward, and kind of in review a little bit, and a little bit of new information here too, is we've all been hearing about a vaccine is supposed to be coming. We don't know for sure when, but hopefully pretty soon. 2021 is what it's sounding like. COVID-19 is not going to go away anytime soon though, so we do have to keep continuing to support ourselves and each other. One or more vaccines and therapeutic drugs that they're using, of course, are starting to be tested and everything, and vaccines should be available in 2021. But then again, it's going to take some time to get everything distributed throughout the entire population. After effects on mental health, we're going to be seeing things for a while. Also, caregiving stress can result in some post-traumatic stress disorder-like issues. Maybe could be noticing those in yourself, in others. Hypervigilance could be one. Startling easily could be another. Different things that you could notice in that post-traumatic stress like syndrome. Could be even after this, we'll have a new syndrome, COVID syndrome or something, I don't know. But it's going to be a while. We're going to be noticing effects on mental health, and we're probably going to be having our services utilized quite a lot over time from this as well. And we talked about too, preparing for the holidays when we were putting this together. The holidays are very important for so many people, and it's a family time, and it's a time now we're dealing with some grief and loss in different ways, a lot of different ways. Not being able to be with those older people or get together with as many people, and family is so important during the holidays. People are spending time alone, or I saw a creative way of Zooming with each other and playing games. There's certain games you can play with each other as a family on the holidays. So trying to find ways to connect, but also as caregivers dealing with the grief in those ways. And then if you've lost a client or a patient that you've been working with, or a family member even, there's people dealing with loss of family members. So a lot of grief and loss issues as well going on during the holidays, and then from COVID as well over time. So self-care for the duration and beyond, of course, very important is what we've talked about here. Really, the pandemic is bringing about a mental health crisis in America. We're seeing over 50% of people are reporting that mental health has been negatively impacted by the pandemic. So all those things we talked about in self-care are very, very needed and necessary.
Thank you. And just to add to that, now, when we talk about moving forward, we're really talking about what do we expect next? As Tricia said, the pandemic is not going to end anytime soon. So what we're doing is we're almost adapting to this new life that's become our daily life now. where we're wearing masks to enter into different establishments. We're limited to how many people can do this. Our holidays are starting to look very different. Our interactions with families are becoming a lot more distant. And so this is those moments where you have to maybe be that proactive individual in your family and take initiative. Do I need to reach out to, so-and-so, or I haven't heard from my aunt? It's because some individuals don't know what to do. They don't know how to handle such a big change. And one thing I've heard from a lot of families a lot of family members is, oh, for the first time in 20 years, or for the first time my whole life, we're not doing this for Thanksgiving, or we're not going to be going on our Thanksgiving hike. And then now you imagine they're probably at home on Thanksgiving trying to find new ways to make up for what they're used to. So maybe taking the time to plan ahead, find out what it is that you're going to do over the holidays. Just planning ahead in general, find out what your next steps are, just preparing yourself, maybe even if you have kids, getting them excited for it, as if this is a new adventure, while still being cautious for, with the fact that there is still a pandemic out there. These are just really great ways to cope and then be more prepared on trying to adjust to how life may be for the next, year or two, hopefully not any longer than that. But we could handle maybe another year or so. That's me speaking for myself. Don't think I'm speaking for everybody that one. But yeah, so just be prepared. Just be prepared for whatever comes next. But as long as you have coping skills and you understand and recognize those stress levels, it's going to make a huge difference in how you really attack the next steps of the pandemic.